Our new medicine, SBP 9330, is what we call a neuromodulatory drug. And what I mean by that is that if you think of a light switch, you can turn a light switch on or off. And that's an analogy to many traditional medicines, that when you take the medicine, it enters your body and it has an effect on your system in that it either blocks it or activates it. So it's black and white, yes or no. Our drug is, we call it modulatory because it has a much more subtle effect. And so the analogy is, rather than on-off switch for a light, it is like a dimmer switch, so that you can have it partly on or partly off, and you can, and so what you're doing is you're having subtle effects in the key areas which affect substance use disorders. So sadly, for people with addiction problems, and the term we use these days is substance use disorders. So for example, smoking will be tobacco use disorder. Still a huge problem, causes heart problems and cancer. Alcohol use disorder, and then drugs of abuse, which include things like methamphetamine, cocaine, and very topically, opioids, so oxycodone and so on, which are abused. And unfortunately, despite the fact that there are many people with problems, addictive problems, there is very little out there that can help them. And so our drug is a completely novel mechanism that would be used to treat these disorders. We just completed our phase 1 clinical trial. So the drug has been dosed in healthy humans and also healthy smokers. We're currently, the funding we just received is to prepare the drug for phase 2 clinical studies. And so we would anticipate being ready to start phase 2 studies in the next 2 to 3 years. So far, we've shown that preclinically, 9330 is effective in models of smoking addiction, also cocaine, methamphetamine, and also opioid use. And so that's currently where we are. We've also, we're collaborating with Camino Pharma LLC, that just received a U43 SBIR grant to look at our drugs in alcohol use disorder. When we do preclinical studies, we look at self-administration, which means just taking, can you reduce the amount of drug which is being taken? But the second component, we also look at models of relapse, because, as I'm sure you're aware, addicts, they may temporarily move away from their addictive substance. But then if an alcoholic happens to walk into a bar, is triggered to drink more, then that's what we call relapse. Or if a drug user is exposed to the paraphernalia, whatever, if a smoker is in an environment that they've become used to smoking a cigarette, this can trigger. So we're looking at both the administration of the substance and also the relapse component.